If you see here, for internal medicine, I used Harrison's book. Now you may have been using other books like Davidson, but I prefer Harrison because if you see in Harrison, they have covered the other topics as other subject topics. Like if you take a topic in Harrison's, they would have given the physiological aspect, the pharmacological aspect, and the pathological aspect in very detail. So when you read a topic in Harrison's, you need not have to again go through any physiology books or pathology books separately. All you can get in one book. That is why I preferred Harrison, and it really helped me in the exam. Now the important topics to see in IM. First, let's see about the cardiovascular system. Now these red ones are the very important ones, and almost there have been questions every year. These black ones are important ones as well, but not as important as the red ones. If you see here, the topics in cardiovascular system, mainly they ask about the rheumatic fever and what are the complications, then the ECG basics, that is the waves, what type of waves. Then they are also asking about ECG abnormalities, mainly about the atrial fibrillation. And they also ask other associated topics related to abnormal ECG patterns. They don't give an image, so you can read in that way, like answering a case question. They also ask about the heart murmurs, the systolic, diastolic and continuous murmurs. Know the types of systolic murmurs, the types of diastolic and the types of continuous murmurs. Then learn about heart sound, hypertension, mainly the treatment aspect of the hypertension and heart failure. The infective endocarditis, you have to focus more on the pathological point of view, the type of vegetations and all those things. Then electrolyte abnormalities. They also ask about coronary heart disease and cardiomyopathy, and the other important one is the basic life support. Read about the CPR, cardiopulmonary resuscitation, the number of cycles to be done, the number of breaths given, and all those criterias. And the central nervous system, they mainly ask about the migraine headache and the other types of headache, and they also ask about these emergencies, SAH, EDH and STH, subarachnoid hemorrhage, epidural hemorrhage and subdural hemorrhage. Learn the CT findings, and then they ask about the strokes and the stroke syndromes, the Weber syndrome, Parinard syndrome and the stroke management. They also ask about the Alzheimer's, Parkinson's, GBS, myasthenia and ALS. You also have to learn the new drugs that have been approved for these diseases. Then for the respiratory system, learn the different types of breathing. Then about the spirometry. Then read the treatment part of COPD, asthma and pneumonia, all the criterias for the pneumonia. And asbestos, silicosis, thromboembolism, the main CT findings. And you have to read about the pleural effusion. You should know the types of exudative and the types of transudative pleural effusions. And these questions are almost asked in every year paper. The lung cancers, ARDS and the major topic TB. Mainly about the drugs when you see in an internal medicine aspect. Then for the renal, you have to read the renal function tests, the proteinuria, hematuria. Then the acid-base disorders, the nephrotic syndrome, the nephritic syndrome. Mainly they ask about the associations of FSGS, and they also ask about the post-streptococcal glomerulonephritis, IgA nephropathy. Then mainly read about the diabetic nephropathy, the pathological findings. Then renal tubular acidosis, AKI, and then the types of dialysis and mainly the complications of dialysis. For the GIT part, read about the cirrhosis, the metabolic liver diseases like Wilson's disease, alpha-1 antitrypsin deficiency, hemochromatosis, the viral hepatitis markers, and the most common hepatitis in transfusion, in adults, in children, all those things. Then you also have to read about the GERD, peptic ulcer disease, and mainly the malabsorption syndromes, the celiac sprue, tropical sprue, those things. Then Crohn's and ulcerative colitis, then the carcinoid tumor. When you read the carcinoid tumor, read a little bit about biochemistry as well. For the endocrine, all these pituitary disorders, then mainly the diabetes mellitus. As you know, there are lots of cases of diabetes in India. These topics are almost always asked. Then the thyroid disorders in IM aspect as well as in surgical aspect. Hypothyroidism, Cushing's versus Conn's versus Addison's. Know how to differentiate them, because these are asked in the case types of questions. Then pheochromocytoma and the MEN syndrome. Type 1, type 2, type 3 men. In the rheuma part, read about rheumatoid arthritis, SLE, all those criteria for diagnosis, and gout, mainly the pharmacological aspects of gout, scleroderma and the vasculitis types, the P and K, C and K types. Then for pediatrics, I used Guy's Essential Pediatrics. This book is also a very good book for pediatrics. Pediatrics topics to be covered are, for starting, we'll see the general pediatrics, then we'll go to systemic pediatrics. In general pediatrics, the growth and development, puberty, the stages of puberty in men and women, the anthropometry measures, the weight, when the weight doubles, when the height doubles, the growth chart, WHO, ICD growth charts, and short stature and types, and mainly the milestones. These questions are most important here. Then the breastfeeding. Everything about this is really important. Read the proper attachment and the properties of breast milk, the nutrition and immunological properties, and when breastfeeding should not be done, when it should be done, and human milk versus cow's milk. You should also read about the malnutrition, the best indicators, the weight for height, height for age, then kwashiorkor versus marasmus, rickets scurvy, and night blindness, what is the dose of treatment, and those things. Then the genetics part, you read about the Down syndrome, Edward Patau, Turner versus Noonan, and Klinefelter syndrome. When you read the Down syndrome, you also read about the associated aspects in this, and also the in OB prenatal screening about Down syndrome. In newborn, the duration of each period, what is the fetal period, neonatal period, infant time, all those things. Then the types of low birth weight, extremely low birth weight, and those things. And short for gestation age, large for gestation age. Read about Apgar and Ballard scoring, newborn initial care, the temperature, cord clamping, all those things, and normal versus abnormal features in newborn. Then read about the neonatal resuscitation, the steps of neonatal resuscitation, when should CPR be done and when should it be stopped, all those things. The neonatal sepsis, the most common causes of sepsis and all those things. Birth asphyxia and transient tachypnea of newborn versus hyaline membrane disease. And just give a go through on neonatal jaundice and types. The Gilbert syndrome, Krigler-Najjar's. In systemic pediatrics, if you see in CNS, out of these topics, mainly to be covered is the seizure and epilepsy. In respiratory system, you have to read about the pneumonia and the management of pneumonia in rural settings. And in cardiovascular system, read about the heart defects mainly and Kawasaki disease, and you should know about the fetal circulation. In GIT, majority of the questions are asked from the diarrhea treatment. know the Holiday-Segar formula. In renal system, mainly about the UTI, the criteria for diagnosis of UTI. And in endocrine system, the hypothyroidism and CAH. For surgery, I preferred Bailey and Love's book. You may have been reading the SRB manual and other books, but I thought this book was really good when you see about the surgical aspects, because it also covered the anatomical part very well. So for the surgery, if you see, let's start with the GIT esophagus. The main thing is achalasia cardia versus esophageal cancer. Know how to differentiate it. And then the hernia, Boerhaave syndrome, and mainly the GERD treatment, Barrett's esophagus, and the Ivor-Lewis techniques and all those things. Then for the stomach, you have to read about the peptic ulcer disease and the surgeries for that. Then the gastric cancer, what are the outcomes of gastric cancer, and I have been asking about the bariatric surgery topic. This is a new topic. Nowadays many questions have been asked from this, so look after it. Then in the liver and spleen, they mainly ask about the hepatocellular carcinoma and the fibrolamellar variant of it. Then know about the variceal bleed and the different types of surgery for it. They also ask about the other topics like the abscess, hemangioma, adenomas, and liver transplantation, splenectomy and complications. In the gallbladder and pancreas, mainly the cholecystitis and acute pancreatitis have been asked many times. Also know about the other cholangiocarcinoma, the Klatskin's tumor, and pancreatic cancer. For the intestine, the intestinal obstruction, intussusception and volvulus, the signs that are seen in the X-rays and ultrasounds, omphalocele versus gastroschisis, Hirschsprung's disease, and the appendicitis and the Oshner-Sheron's regime, colorectal cancer and the treatment for it, the outcomes, and mainly the hydrocele and the treatments for it. For hernia, the inguinal hernia, direct versus indirect, and the different types of named hernias, you should know that, and the femoral umbilical or the lumbar hernias. For the urology, you should see mainly about the renal stones and the renal cancer, and BPH and the prostate cancer. And all other these topics have been asked occasionally, like the vesicouterine reflex, testicular torsion, bladder cancer and all those things. For the head and neck type, this is one of the important topics in India, the oral cancer. And types of neck dissection, the salivary gland tumor and the stones, and the thyroid cancers and the complications. This is very important, the different types of thyroid cancers. And for the breast, mainly the malignant tumors, and the sentinel biopsies are asked recently. Then for the trauma part, the pneumothorax and how to differentiate it from the other types, the hemothorax, and what is the immediate treatment. And then the ATLS protocol, the primary survey, secondary survey, all those things. Then vascular surgery, mainly they ask about the varicose vein because it is prevalent, and also Burgess disease because there are lots of smoking. In the plastic surgery, mainly know about the burns, the classification and what are the fluids given. They also ask about the skin cancers and the types of skin graft. In the general surgery, mainly about shock and sepsis. Then these are mainly asked in the interviews, suture and types. For OB-GYN, the DC data and SHOS. If you see in the obstetrics and gynecology, most of the students like it because it is easy to learn and it is given in a algorithm format for all the problems. The treatment is given in an algorithm, So mainly they ask cases about these topics. If you see in the obstetrics, mainly read about the big four, the PPH, APH, and pregnancy induced hypertension and diabetes. Then also read about the major problem in India, that is about anemia, and the emergency ectopic pregnancy treatments. Apart from these, they also ask about the normal labor, abnormal labor, and the episiotomy types, the molar pregnancy twins, and the types of placentas, and all those things. For the gynecology, first know about the menstruation. Then you can read about the PCOS, which is an important problem, and the types of cancer. The most common genital tract cancer in India, that is cervical cancer, and types of hysterectomy, genital tract infections, and contraceptions. We also ask about the primary amenorrhea, secondary amenorrhea, and Mullerian abnormalities. For PSM, Parkes PSM. Usually in these exams they give you paper and pen, because they are going to certainly ask case questions on PSM. These questions like this, you will have to calculate it in the paper and write the answer. So definitely there will be 2 to 3 questions asked like this. So for the epidemiology part, mainly read about the cohort and case control study. In the vaccines, all those things are important. Mainly you have to read about the updated schedule of national immunization vaccines, and also read about the COVID vaccines and the levels of prevention, primary, secondary, tertiary, and some cases are been asked in this screening, specificity, sensitivity, calculated. And the OB-GYN and pediatric preventive care medicine, we will be asked about iron and folic acid supplementation and the breastfeeding. Apart from this, you can answer it by reading in OB and pedia. For the nutrition, they will ask about the vitamins and also the food adulterations. In the social health, mainly the Kupuswamy score. And the environment, they will ask about the international health agencies like WHO, UNICEF, where are they located, and the types of bioterrorism, and the water, types of water, hard water, soft water, and all those things. In the healthcare system, they will ask mainly about the family planning, the contraceptives available in India, the new ones available, the old ones. And you will also have to know the main healthcare system in India, the primary healthcare, the sub-center, the primary health center, and the ASHA workers, and all those. In the communicable disease, the TB, polio, malaria, leprosy, the ones that have been asked regularly in other exams, they are also being asked regularly in this exams. And then the non-communicable disease, about the blindness and the vision centers, all about the cancers, obesity, diabetes, hypertension, and all those criteria that we use to calculate them. And in other topics, mainly they ask about the biomedical waste. Mainly this time they may ask about the coronavirus. And in biostatistics, many case questions would be asked.